I'm diving into the world of caffeine and pregnancy to figure out if it's really safe. Join me as I explore the facts and myths surrounding this hot topic. Caffeine is a staple in many of our daily routines, and for some, it's hard to imagine getting through the morning without a cup of coffee or a can of soda. But for expectant mothers, the question of whether caffeine is safe during pregnancy is a pressing one. One of the biggest concerns surrounding caffeine and pregnancy is the risk of miscarriage or preterm labor. Some studies suggest that high levels of caffeine consumption may increase the likelihood of these complications. On the other hand, other research claims that moderate caffeine intake has no significant impact on fetal development. It's no wonder that expectant mothers are left feeling confused and unsure about what to do. Add to that the conflicting information from health professionals and organizations, and it's easy to feel overwhelmed. The American College of Obstetricians and Gynecologists, or ACOG, recommends that pregnant women limit their caffeine intake to 200 milligrams or less per day, while other organizations suggest avoiding caffeine altogether. So, who's right? Meanwhile, many pregnant women are left wondering how to navigate their daily coffee habit, or whether they need to kick the caffeine habit altogether. It's a difficult decision, especially when you consider that caffeine is found in so many common foods and drinks, from energy bars to chocolate. Despite the conflicting information, the current research on caffeine's effects during pregnancy does offer some valuable insights. Studies have shown that high levels of caffeine consumption may affect fetal heart rate and blood flow, which can have long-term implications for the child's development. On the flip side, moderate caffeine intake seems to have little to no impact on birth weight or overall health. However, it's worth noting that individual tolerance to caffeine can vary greatly, and what may be safe for one woman may not be safe for another. Furthermore, research has also shown that caffeine can pass from the mother's bloodstream to the fetus, and high levels of caffeine in the womb may affect fetal brain development. So, what do the experts recommend? According to ACOG, pregnant women should limit their caffeine intake to 200 milligrams or less per day, which is roughly the amount found in one 12-ounce cup of coffee. Other health professionals suggest erring on the side of caution and avoiding caffeine altogether, especially during the first trimester. The takeaway is clear. While moderate caffeine intake may be safe, it's essential to be mindful of individual tolerance and to prioritize fetal health above all else. Pregnant women should talk to their healthcare providers about their caffeine intake and create a personalized plan that works for them. In conclusion, the debate surrounding caffeine and pregnancy is complex, but by exploring the facts and myths, expectant mothers can make informed choices about their daily habits. Remember, it's always better to err on the side of caution when it comes to fetal health. Thanks for watching, and I'd love to hear from you in the comments. Have you struggled with caffeine cravings during pregnancy, or do you have any questions about staying healthy during this time? Let me know, and don't forget to check out our next video on pregnancy health tips.